Hi, everyone. I'm Julia Longoria, host of The Experiment. It's a podcast from the Atlantic and WNYC studios. And a little background about the show in case you haven't checked this out yet. The Experiment is called The Experiment because over the last year or so, our team kind of watched the way our country has felt like an experiment, like democracy is an experiment. And as we went through a global pandemic and an insurrection on our nation's capital, we just felt that experiment was really alive. And we weren't sure where it was going. So the show aims to check in on how that experiment's going. And it's really a show about the ideals of our country, the founding ideals of equality and justice and democracy. And we try to explore what happens when we bring those ideals down to earth. And the way we do that is by telling stories of ordinary people who kind of bump into these ideals in their everyday lives. So, for example, in our first episode, we tell the story of an elk hunter, actually, this man who stumbled into this place in Yellowstone National Park that is a sort of hole in the Constitution. It's a place where technically you could get away with murder. So if you want to hear about that episode, you can check out our very first episode called The Loophole. In another episode, we talked to actually a business professor who had a very rare experience in this country. He actually was in the room when two people were executed by the federal government. He volunteered to be there. And he tells really powerfully, he talks about his experience through all of that. And we've also talked on the show to Atlantic writers. Van Newkirk told us about how fragile our democracy is by telling the story actually of his mom's life. So he talks about how our democracy, our true democracy, is only as old as his mom was when she died last year. She was 56 years old. And he makes the case for a voting rights amendment to kind of preserve American democracy, because he says true American democracy kind of hinges on the Voting Rights Act. We also do lighter things. We talked to Atlantic writer Amanda Mole, who has a piece about sweatpants and sort of the American mythology around sweatpants and how sweatpants are laziness. And she kind of deconstructs that myth and talks about how it comes from our sort of puritanical origins of discipline and work ethic. Our latest episode is what we're here to talk about today. It's a collaboration with staff writer Olga Khazan about a man named the Rock Doc, or he's not named that, he calls himself that. He is actually a nurse practitioner from Jackson, Tennessee, and he was indicted as part of the biggest crackdown we've had on opioid prescriptions in history. Allegedly, he was overprescribing opioids and having sexual relationships with some of his patients. Olga's been covering the opioid epidemic for 7 years, and we heard this story was coming out, and we approached her and wanted to make an audio version of it. So she actually went to Jackson to find out basically how this could happen. Like she says in the episode, she has a lot of how on earth questions, like how could this happen to a doctor? Why would anyone go to see this doctor? How could he get away with this? And when she went to Jackson and started talking to his actual patients and the people who knew him, what she found really surprised her. So Atlantic staff writer Olga Khazan is going to join us very shortly to talk about her work and about this week's episode and how we made that story come to life in audio. We are only a handful of episodes into this show, which is a bit of an experiment on its own. And I just want to say, I'm just so grateful for the outpouring of support we've heard and seen from listeners like you. And we also want to thank our underwriter, BCG, for their support of the show and also for making today's event possible. we want to thank you, all of you also for joining us today. And we're hoping to incorporate some of the questions you have asked us already. We have a lot of great questions already, and any you might want to ask during this event that we're all here together doing. So with that, it is my pleasure to introduce to you Atlantic staff writer Olga Khazan. Olga, you've been covering the opioid crisis for years now. I'm curious what interested you about this story of the Rock Doc in particular?
Yeah, so kind of at the time that I was covering opioids, and there were so many different kind of threads of that story, like the Sacklers and how did these medications get made? Why were they pumped out through so many doctors? Why was there so much overprescribing? Why wasn't anyone monitoring the fact that like these are so addictive and that they're flooding into communities? But sort of another thing that was happening when I was looking into this is the Me Too movement. And I actually started hearing about all these cases of like this horrible confluence of the two things where doctors would overprescribe to patients, and then patients would become addicted. And in order to kind of continue getting their prescriptions, in order to continue being able to get the pain relief that they relied on, the doctors would actually like extort them for sexual favors. And when I heard, so there was sort of like all of these indictments that came down, as you mentioned, of dozens of doctors. And I started reading through them, and the Rock Docs just really stood out to me because it was so egregious. He made a reality TV show about himself. He posted all over social media what he was doing, like how crazy he was. And I was just like, this can't be real, that like this guy who is supposedly doing this like kind of bad illegal stuff is also so out there and so public about it. So I felt like I had to learn more and just like get to the bottom of what this was about.
Totally. And like for us, I think we were immediately intrigued by the name, the Rock Doc, like as someone involved in the opioid crisis. And it's been really interesting just to see this one example of how the opioid crisis happened, like this huge thing, but finding a really narrow lens to see like how this unfolded in some of the people you talked to's life. I'm curious, like, where did that name come from? Like the Rock Doc, why is he called the Rock Doc?
Yeah, so the Rock Doc is actually not a doc. He's a nurse practitioner in Jackson, Tennessee, as you mentioned, which is this town halfway between Memphis and Nashville. And he is like this, like this kind of unassuming Southern guy, I would say, like nothing like too remarkable about him. But then kind of like a few years into his career, like as we, I think, talk about on the podcast, like he kind of started taking on this persona of like, I'm a rock and roll guy, which sounds kind of weird, but he started getting like tattoos. He started riding motorcycles. He started like posting on Instagram of him with like strippers and like smoking cigars. And so he was really like, I'm not a regular doctor. I'm like this rock and roll nurse practitioner. And he hired a cameraman to come like make a reality TV show about him. And as part of this like brand building exercise, he started calling himself the Rock Doc. And that was sort of how his fans and people around town knew him, as like, oh, the Rock Doc. You know, his office was like, I think one of the patients told us that he was like, it was like all rocked out. So he would have like rock music playing, obviously, but also like these weird, like psychedelic, like portraits everywhere. And like everything about him was like, I am untraditional. I'm like this rock and roll guy. So yeah, that was another part of his whole thing.
Yeah, I mean, as somebody who's had like very stuffy and stiff interactions with doctors, I guess, kind of see how like someone who would like bring that whole interaction down to earth would be appealing, which you kind of hear from patients themselves. So you wrote this print piece, and then we came to you and said, hey, like we want to make an audio story out of this. What was your experience working in audio? I think this was your first time. Like, did the story for you, the story of the Rock Doc that you knew so well, did it change at all in your head when you were making the audio story?
I think for the audio story, we focused a lot more on the patient's stories. So I think getting the print piece, like there were just so many elements of it that we had to like explain, like, okay, here's the opioid crisis, here's how he fits into it, here's how he like got started, here's the DEA raid against him, here's the indictments, here's what's in the indictment, here's like us requesting comment. Like it was like so much, like it was like, you know, a story, it was like a written out story. And I felt like the audio version was more like interviews with it was like very driven by the interviews with the patients, and it really focused more on why did people see this guy? Like, what did they see in him? And what was it about past medical experiences that would lead them to put up with someone like the Rock Doc? And basically, I mean, the takeaway that I had was just that they felt like no one else listened to them. And the Rock Doc, you know, for better or worse, was like very charming and very good at like, you know, he almost had that like Bill Clinton style of like making you feel like you're the only one in the room. And I mean that in every sense of the word, because obviously like Bill Clinton has also had like allegations against him. But I think that's like, that was like part of his charm, is like he kind of would make you feel really comfortable, really relaxed. He would, and not even in a sexual way. I think just a lot of times he would like meet people where they were at and kind of, you know, if someone was like struggling with their weight, he wouldn't, you know, guilt them or anything. You know, he was like from around there, so they didn't feel the kind of that like, oh, I'm, you know, above you. I went to this great school and like you're nothing. You know, he was sort of like on their level. And I think ultimately, at least according to federal prosecutors, he used that trust to take advantage of a lot of his patients. But initially, at least, I think a lot of them felt they felt comfortable, which is like what we say in the podcast.
Yeah. Yeah, I think for, you know, for audio, like the, at least the kind of documentary stuff that we do on the show, like the best way in is usually like through characters and a really like one idea and really zooming in on the emotions like around that idea, which I'm always jealous of print people, because you could just like add a paragraph about something else. And
yeah, exactly. Like stepping
yeah.
back into the entire like crisis. Yeah, yeah.
Yeah. Where with audio, it's kind of like you can't suddenly just change the subject in
Yeah.
the same way.
Yeah.
But yeah, both have their challenges and their perks. So the show is about kind of our country, the American experiment, and where we're going, and checking in on sort of like the founding ideals and sort of the culture that we find ourselves in now. I'm curious, like if the Rock Doc, the story of the Rock Doc for you told us anything about like our country and our values and where we're headed, if anything.
Yeah, that is such a good question. I mean, I think it really exposed the crappiness of the healthcare system, which is not really news to me, unfortunately, because I've covered healthcare for so long. I do think that there is this tendency in the US, for whatever reason, to see doctors as like so amazing and like you're so great and like you're just beyond reproach, and like that's actually kind of how they're treated by the criminal justice system too. It's like a lot of the print story in particular talks about how there's like kind of this gloves off, like, or like kid gloves like approach to doctors. Like if doctors do something wrong, they go before a panel of their literal peers, like their other doctors, and the other doctors are like, well, you kind of did something bad, so we're going to suspend your ability to like see this type of patient or to prescribe this type of medicine for 2 years. And you know, if you're like a poor person who does something bad, you go to prison. Like you don't like lose the ability to like, you know, do your job in the exact way you want for a little while. um so it really like shed light on like this completely different justice system that we have for medical professionals. And like, even though like it's great, like doctors go through a lot of training, they work really hard, but like, should we really be trusting doctors this amount that we kind of give them like the benefit of every doubt and let them go on for so long without any scrutiny of anything they're doing, because often what they're doing is like really, really bad and it happens behind closed doors. So I don't know. I'm sorry if that's kind of a negative message, but that's yeah.
Yeah, I mean, for me listening to the story, it's sort of like the rock doc tapped into this thing that's often missing in like patient doctor interactions, which is just like listening to the patient and taking the patient seriously. So in that way, it's like he filled this vacuum and was able to kind of, you know, seems wreak havoc in that way.
Yeah, like it's so stupid. Like the way that the Rock Doc was able to get ahead, it was just listening. Like, you know what I mean? Like he's not a criminal mastermind. He's just like has good people skills, and like that is like, you know what I mean? And I feel like the other thing is that like, you know, so many doctors are driven to just like, you know, see you for 10 minutes, prescribe something, see you for 10 minutes. And he did ultimately move toward like more of a prescription mill thing. But I think at least initially he made people feel like, okay, I'm going to listen to you. I'm going to make sure I understand the full problem. We're going to get to the bottom of this. And like those kinds of messages for patients can be really reassuring.
Yeah, like I'm going to take your pain seriously.
Yeah,
Yeah,
exactly.
yeah. Um, do, do you think he's unique in kind of the larger story of the opioid crisis? Like, give us a little context for the other doctors you've kind of looked into, or how he kind of fits in.
Yeah, so he's literally not unique. There's more than 40 other doctors that I found that have done this exact same thing in the last 5 years. That's just from like reading news clips. So that's only the cases that we hear about, which is not every case because most of the cases before medical boards and nursing boards are private or not public. Basically, no. A lot of doctors are doing this. Unfortunately, I think I found one study that found that it's mostly doctors who are in like independent solo private practice who don't have a lot of like checks and balances on their daily activity. What they would do to like basically take advantage of their patients in a sexual way is to get them addicted to opioids first.
It's just like, it's wild.
It's really messed up. Yeah.
Yeah. Yeah. And what's next for the rock doc in terms of his trial?
He is detained right now. He's detained facing trial. So his trial is scheduled to be this fall right now, but these things keep moving because of the pandemic. So, like one of the things that I think is like an actually interesting point that people make is that like he actually has already served a lot of time, like just waiting for his trial, which is like another problem of the justice system. But like, so he's been detained for like 2 years now, just waiting for his trial, and it's looking like it'll be this fall, but it's not really certain that it will be then. So yeah, and then I actually have a question for you, which is what is next for the experiment? What's like coming up, and what are you working on?
Yeah, so we're taking a break for 1 week, but in a couple weeks you'll hear the story from correspondent Tracy Hunt. She's interviewing David Truer, who is making the case to give our national parks back to Native people. So he kind of explains what he means by that and what that would look like, and Tracy interviews him for that story. So that's coming up. So I guess now we can take some questions that we got from some of you all. Let's see. Matthew asks that we highlighted several patients that showed the complexity of Jeff Young, which Matthew appreciated. He wondered if it was hard to find those people, or was this a general sentiment that you found, Olga, among his patients? Did you speak to any that were negative about his experience with him?
Yeah, so I did talk to patients who had negative experiences. Unfortunately, none of them wanted to talk on the record. So that made it harder. I think the process was a little bit skewed by the fact that the people who really wanted to talk for the podcast were like huge fans of Jeff. So it was like it was hard to like keep like the balance that like he is actually in big trouble for doing like supposedly really bad things. So it was like a little bit tricky to be like, but these people love him, but he like maybe not everyone loved him. I think also like one thing, if I may say, is that I encountered like a little bit of almost like a slut shaming vibe in this area, where if I would talk to someone and they had been mistreated in a like sexual way by Jeff or by someone else, they kind of tended to internalize a lot of that guilt, and it would turn into like, don't use my name, don't use my, don't use my story, I don't want this, like it would almost be like they don't want their story told because they're embarrassed that they like somehow let it happen. So I encountered a lot of that. So I think that might also explain why the people who had negative experiences weren't willing to come forward as much.
And I feel like that's also a key difference between like the audio version and the print version. When for audio, it's hard to, you basically don't have a story until someone talks.
Yeah.
We did our best to include both sides or all sides of the story, but inevitably it might feel like we're giving more weight because we let the people who supported him talk. So that's also a challenge. All right, we have another question. Keith from California asks, between the two of us, how many hours were involved in the research, writing, editing, and revision of a story like this?
Oh my God. I wonder if Alvin would be like, I have something to say about this. Just for the audio story, it was so many hours. I mean, sorry, I don't know if I'm supposed to give a more PR-ish answer. It was a lot. It was a lot. I mean, there was like just the interviews. We probably have like 15 hours of just interviews, plus to set them all up was however long that takes, like 5 hours or so. Plus, like, we went through so many versions. Plus, after you have a version of the script that works, you have to track it multiple times. So you have to like, I was like saying every sentence multiple times in like different ways, and like now put the emphasis on this word. It took so much longer than I thought it would. And I don't mean that in a bad way. Like, I was like, wow, like, I can't believe that they put this much effort into every, like, I don't know. I feel like you listen to those, like, This American Life or whatever, and you're like, oh, this sounds so easy. You just talk to some people and like,
like all Ira Glass does is talking to a microphone, right?
Yeah, like it's so simple. And then you're like, oh God, it's actually like really precise and really, really time consuming. So yeah, sorry, I don't have a precise answer there. I probably would prefer not to count the hours.
Yeah, I mean, for us, like the drafts that we go through are like literal, like you have to
say it,
talk into a microphone, and then we listen to it. So you have to like kind of produce it and arrange it and put it all in order and then listen. And that's draft one. And then you do draft two. I think we were on draft like 23. I think we were on V23.
It was so many.
So yeah, it's a lot of hours. Starting with a story like this, especially, it's hard because we were trying to get people to talk to us about their most intimate encounters, like with their doctors. So a lot of it was like our, producer Alvin was calling people and kind of like hounding them to some extent, trying to see if they would talk to us, and trying to be sensitive to them, and all of that was also a big part of the process. All right, so let's see. Katie from Missouri asks, from Paris Hilton sweatpants to a Swedish-born anti-vaxxer, the topics have been wide-ranging. That is true. How do you pick what to cover? So I can answer that. I think how do we pick what to cover? I think we aim for at the core of every episode, there be a sort of story we tell about ourselves in the country, that we try to like a myth that we try to examine. So like, I think that's what like the sweatpants episode and, the Van Newkirk episode about democracy actually being fragile have in common. And I think for us, like we were saying about getting people to talk to us, a lot of it is like who will talk about their experience, their personal experience in a real way. And is that experience compelling and make you feel complicated or make, kind of shed new light on something you thought you already knew about. So it's like both, finding like a range of topics and at the core of them, like an idea about who we are, but also just like someone you want to listen to, someone whose voice you haven't heard, someone who has like an interesting perspective to bring to it. So a lot of it's just like making phone calls and pre-interviewing and trying to find those characters.
So much of journalism is just like, hey, you seem interesting. Like,
Yeah.
what's going on with you?
Totally. I just want to talk to you forever. So, yeah. It feels like kind of a cheat code to life. Like
I know.
People just pick up the phone and talk to you about their lives.
Yeah.
All right, let's see. What other questions do we have here? Chris from New Jersey asks, Olga, is there any state or federal monitoring of opioid prescriptions being done to catch doctors like this?
Yeah, so I have to say that there is better monitoring now than there was like when the Rock Doc first got started in 2013. Now doctors are supposed to, like, if they prescribe a patient opioids, they're supposed to like log it in a system and be like, I gave this person opioids. Like, no one else should do that for like a month because this person has enough to last them a month. So that way the patient can't go like from place to place and get opioids from each doctor. But I will say that like the problem with the Rock Doc is that he just didn't do that. Like, he was supposed to also be logging that, and people were also supposed to be checking what he was doing, but that just didn't happen. Like, and he just got away with it for a really long time. So like there are better and stronger systems in place, but it's not totally resolved. And like, in fact, I think there was a story not long ago, like a month ago or so, that found that doctors are still way overprescribing opioids and prescribing way too much. I mean, unfortunately, the answer is that we just have to cut way back on the number of prescriptions. Like, these drugs are very addictive and are not good for people to take for chronic pain. So the answer is cutting way back, but people don't really, it's not a popular thing to say.
Yeah. And we have one last question from Nikki. She asks, the opioid crisis seems to be escalating in the US in some areas more than others. Are there other countries with similar high rates of addiction to opioids?
That's an interesting question, and I do not know the answer. I would have to look that up because it's very like moment to moment specific. So I think that's something I looked up like a few years ago and then promptly forgot. I definitely have done some opioid reporting in Canada, but that was less like OxyContin and stuff and more like heroin and things like that that people were addicted to. So your regular street drugs. I will say that other countries have a little bit more, like tighter constraints on both like what doctors can prescribe and how much pharmaceutical companies can actually interact with doctors and how much they can advertise to patients.
Interesting. All right, so I think we're going to leave it there. We're running out of time. So thank you, everyone. Olga, thank you for the conversation. Thank you to BCG for making the event possible. And thank you, all of you out there watching and listening to the experiment. We really appreciate it. If you're not already subscribed to the experiment, may I suggest you go to your podcast app, wherever you get your podcasts, as we like to say right now, and search for the experiment and hit subscribe. That way you'll get every new episode right on your phone. We are, like I said, we're off this week, but we're going to be back next week with a brand new episode. If you're a subscriber to The Atlantic already, we just want to say thank you for your support. If you want to be a subscriber, you can go to theatlantic.com/subscribe. Theatlantic.com/subscribe. You can access incredible work from Olga and so many of our colleagues. And we also want to say that there is a new exciting Atlantic Live event on our horizon. May 20th, we're going to explore the human hold on happiness in an event called In Pursuit of Happiness. We'll talk to Arthur Brooks, our How to Build a Life columnist, and many others. So you can register for that event at pursuitofhappiness.com. Sorry, I messed that up. It's pursuitofhappiness.theatlantic.com. Pursuitofhappiness.theatlantic.com. Thank you all for joining us today. I hope you'll listen next week on The Experiment.